first case I saw at the cancer center left me deeply shaken. And unfortunately for me, I had to work with two other of my colleagues to prepare the case report, accounting for what happened to this patient from the very beginning of the illness to the end. So let me tell you the story. Now, this was not a story of this patient did not come for treatment, but because of poor follow-up. Now, this woman discovered she had a lump in her breast about 4 years ago. A year later, she had to take out the whole breast. They did mastectomy and took out the whole breast. Then she did 6 cycles of chemotherapy after the mastectomy. But after that 6 cycles, maybe she got advice from somebody. She went to a herbal center to continue her treatment. She noticed that things were getting bad. She now left there to go to a private clinic for management. When she went to the private clinic, she left again saying there was inadequate care. She went to the house. We don't know if she continued with the herbal medicine. Then this was her coming to the hospital again, and things had already gone bad. So they told her to go do a CT scan of the chest, and they noticed that this cancer had spread to her lungs. This lump that had already been taken out 3 years ago, because she did not follow up treatment, the cancer cell is spread to her lungs. She stayed in the hospital for a while, left the hospital again. When she came back, this cancer cells had spread to her liver and some other internal organs. And the worst of them all was that it spread to her brain too. So she was even talking like someone that is not feeling sound upstairs. They could not get any information from her. They had to talk to her elder sister. So she stayed in the hospital again for a while and left. When she left this time around, hear what happened in the house. Because she had this metastasis to the brain, she had issues with stability. So she fell in the house. And when she fell, she hit this mass on the ground. And this mass started bleeding. You had to see this mass. In my whole life, I have never seen a mass look that horrible. And she bled and bled profusely. They rushed her to the hospital. Her PCV was already very low. They had to do series of blood transfusions. And at that stage, what the hospital could do for her was palliative treatment, because it was obvious that she was not going to survive. Palliative treatment is just them managing your life, managing you until you meet the Lord. So they're just trying to improve your quality of care. They had to discuss with her family on end of life care. So now the problem with this woman's case, she did not die just because of cancer. She died because of inconsistent follow-up on treatment. When it comes to cancer, follow-up treatment is as important as the initial treatment. It's in follow-up that your oncologist will get to spot if there are any reoccurrences of the cancer. Most likely what happened to this woman, there was a recurrence, right? It's in follow-up they are going to check for complications of treatment. It's in follow-up they are going to even check if there's metastases, and it's in follow-up too when you do your chemotherapy that they ensure that these cancer cells are completely destroyed and cleared off your system. So for more info like this about things that happen in the hospital, please click on the plus button, like, comment and share. You are welcome.